Hello everyone, let's try to solve this question together. So we have a 20-hour-old female infant. She's monitored in the nursery. The labs are provided. The best statement is, pause the slide, take a look. So let's walk one by one. So the dotted line, which is this line, should be followed for phototherapy. So as you guys can see, this is without risk factor and this is the risk factor. And as you guys can see that, infant is Coombs positive and mom has both antibodies. So this baby is at high risk. So we should follow the solid line. So that is a wrong choice. What about the second one? Could be discharged home with close follow-up. Because of the age, babies less than 24 hours of age with this type of trending bilirubin should not be sent home. So 24 hour is a cutoff and here is 20 hour is given. So second one is also not the right choice. What about following bilirubin in Q12 hour? Q12 hour is later. First you should follow more frequent Q4 to 6 and then after few levels you can follow that. So again, this is not the right choice in the given scenario. And of course this is again debatable because this point, the final point, is not touching the phototherapy yet. But if you guys remember that this is still like just within the 2 milligram per deciliter of the phototherapy. So it's your decision because a baby is less than 24 hours of age, so we can consider phototherapy. So this is the right choice in the given scenario, and that is the answer. So let's see here again in detail. Let's start with here. So these, of course, these figures are taken from American Academy of Pediatric Guidelines, and they are very comprehensive. So let's walk through. So here we are, maternal antibody screen done. Yes, it was done. We see it there. It's there. Was it positive? Yes, it's positive, as we can see here. Okay, then so what we have to do, we have to find infants direct antiglobulin test, and we see that it's done. And now we have to see, is it positive? And the answer is yes, it's positive. So now we go here, and here is the confusion. Like in this case, we try to look at this information. We got up to only Ryogam that it was given, but again getting the information, and especially with this negative, two negatives are there that mother known not to have, is give like a double negative impression. So basic idea is, if you don't remember the whole box, just remember if you are up to this point, which means that infant is DART positive, it's always good to see if this antibody is not just because of Ryogam and babies at low risk of, because Ryogam does not cause hemolysis, but NTD does. So we just have to make sure that we know. And sometimes, honestly, this part is very difficult to find out, especially in clinical scenario, because this information is available on maternal charts, and you have to review the whole information. Even with electronic documentation, sometimes this information is missing. So the Academy recommend following this box, but if you are up to this point, then probably we can do this if needed. Try to find that answer, because that will help the baby from prevent the baby from unnecessary phototherapy if your answer is yes. But like I said, practical is very difficult. Up to here, the information is easy to extract. So now let's see. So see here, it says that you have to get it immediately. So waiting for 12 hours does not make much sense here. And then second thing, after you have done 2 levels, then you can do Q12 hours. So so that's why this answer was wrong. And here we already discussed that earlier. But if you can just look at B and look at this option, because infant was less than 24 hours, and if you remember, the phototherapy threshold here is almost reaching phototherapy. So if you follow this one, then of course here is written that you can consider phototherapy. So that makes our choice D as a right choice. Now what about not sending home? As you guys can see that after 24 hours, then they give you an option of seeing if baby can go home. Here you go again with a clean slate. See here it gives you the option of sending home with either home therapy or with a close follow-up. So that option comes after 24 hours. So just remember that. So that's why this is not the right choice. And the first one we already have discussed, based on this final yes and not having this information available, it's better to go with this. So the default should be this, but if you have all the information and it's yes, then it's okay to treat the baby as the return to the basic guidelines. I hope this is a little complicated, but I hope this makes sense. The whole idea is that taking care of Rh negative, mother and their babies who are positive, a lot of things has to be put into equation before the phototherapy decision is made. So I hope this makes sense. Please do comment, and you guys have a wonderful day. Bye.